As a great philosopher once said, got a bag and fixed my teeth. Hope you know it ain't cheap. And on that note, today I am reacting to good teeth are a luxury that only the rich can afford. I work in the eastern suburbs of Sydney as a cosmetic dentist, which is one of the wealthiest places in Australia. And I treat a lot of very wealthy, arguably rich people. I'm going to be reacting to Tiffany Ferg's video and giving some feedback from the Australian perspective as well. I find her journey really interesting because she herself has struggled a lot with her teeth. I was going to make a video like this, but I was just like, she has nailed this explanation so well.
Today I want to talk about teeth and dental care. Now hold on, it'll be interesting, I promise.
This is the thing. People always are like, teeth can be interesting. I'm like, I am obsessed with teeth. Like, I think they're the most fascinating things. Like, I'll be taking photos and I'll have the light bouncing off the texture and the perichromata of the surface. And I'm just like, oh, it's so like dynamic and sexy. And then I'll show it to my nurses and they're like, you are a freak. What is wrong with you?
And we're going to get deep into how our teeth affect us personally, professionally, socially, financially, and physically. For part of my
100%. One of my favorite studies, the average person, when you first see someone, will make a judgment call on you within 7 seconds of meeting you. And the reason being is we as humans have evolved evolutionarily to see, are they friendly? Are they an enemy? Are they a threat? You think about caricatures in cartoons, say, for example, the dumb guy always has buck teeth and a weak jaw, and that shows a lack of intelligence. Witches always have very protrusive, strong lower jaw features and pointed noses. And so if you see a woman like that, you'll immediately assume that she's far less approachable compared to someone who has more conventional jaw setup. So we've been conditioned for a long time to make those judgment calls.
Similar issues exist all over the world, and I'd really love to hear about any of your experiences in the comments. Let's jump the frick in. It's going to be a long one. For many people, one of the first things they notice about someone else is their teeth. Good teeth are considered a turn on, very attractive. If someone has good teeth, we believe that's a sign that they take care of themselves, that they're very hygienic. And later we'll discuss the judgments and assumptions that we tend to make when we meet people with quote unquote bad teeth. To begin, let's start with the
I think sometimes we don't even realize that we're making that judgment call as well. Like, granted, if somebody has really, really not great position teeth and they're very broken down, we're more cognizant of it. But even on a micro level, I think it's one of those things that people would make that judgment call and don't even realize that they're doing it.
Since the 1980s, dentistry in the US has had a pretty big shift from the unsexy, preventative, and restorative care, like cleanings, fillings, extractions, to cosmetic dentistry. It was the Hollywood smile of former actor, President Ronald Reagan, that gleamed over the glamour, conspicuous consumption, and individualism that marked the 1980s. Cosmetic dentistry now represents the largest non-surgical beauty industry after makeup. This includes the multi-billion-dollar teeth whitening business.
I would disagree that it's non-surgical because often there is some level of surgery required to achieve the results that people need. Some of the like very common procedures that we'll do, for example, Bimax surgery, where we'll have the jaw repositioned and moved before orthodontic treatment. And that also improves the airways. It's not just an aesthetic cosmetic thing, it's also a functional thing. Gum grafting, which is where you do like a little procedure. It's a microplastic surgery to drop the gum if you're someone who suffers with recession in the area. Or even gum lifting. There's some people who have beautiful, perfect teeth underneath the surface, and all they need is to have the gum and the bone lifted to reveal the actual clinical crown of their teeth. It's not always surgical, but there are some components to get the proper result that you may need to go down that road. It's not uncommon. Like, if we have a patient who comes in to us, we will often refer them out to a plastic surgeon to organize something like a lip lift, which is where it's the most popular cosmetic procedure. And I think a lot of people get filler done in the upper lip to try and achieve it, but basically your incision goes in underneath the nose and it lifts the upper lip so that it reveals the upper teeth more, because that is one of the most common things of aging is the soft tissue drops. You can do veneers to try and match that, but they'll be incredibly long, very horsey. So by reframing the soft tissue, gives such a better result.
They have made some whiter teeth, especially for the Americans. If you look at that, and their teeth will look yellow now against American teeth. In Britain, we have this scale of colour for teeth, yes. But Americans are actually literally off the scale.
This American smile
That makes me laugh because those top three are like bleaching shades. There's a scale above that. That's not even like off the scale.
Is now a commodity marketed around the globe. Europeans still tend to prefer a subtler look, teeth that appear more natural, but a veneer job has become a globally recognized badge of success.
I'll tell you who does bloody good veneers. Brazilians, South Americans, oh my gosh, like next level natural. So good.
Social media's impact and the influencer smile. Before social media, people were primarily influenced by the style and glamour of traditional celebrities, but these days, most of us have internalized the beauty standards that are currently popular online. Many of the most popular influencers or Instagram models look pretty similar. They may have filler, Botox and other procedures, veneers, and a banging body. As we know, influencers often sell aspects of their lifestyle or appearance as commodities. You can get white teeth like theirs, all you need is this sponsored product.
Pay no mind to the fact that many of these creators actually have veneers.
Yes. Oh my gosh, that frustrates me so much. And also, one of the big problems is you have people coming in and they're like, oh, I want to have my teeth white, like you see on Instagram. And I'm like, yes, but that is porcelain veneers. And so people have these wild expectations of what whitening can actually achieve. And it's like, no, it's literally just a facial for the teeth. We're taking all the staining out. We're leaving you with your lightest, brightest natural shade. And that is not what you're seeing on Instagram. That is porcelain. It's not the same treatment modality, you know?
If they wanted any procedures done because of social media, and many agreed. Among other responses, some said that they just don't smile in pictures anymore because they don't believe that their teeth are straight or white enough to be presentable. And that's really sad. But it can be even worse if you're an influencer/content creator or aspiring to be one. Some of my YouTube peers replied to me on Instagram as well and said that as they started to gain a following, they started to feel more self-conscious or felt compelled to fix their teeth, quote unquote, because they're
I think as well, it's something that even like in the corporate space, everybody's doing Invisalign. You don't know what you don't know. And then sometimes, especially at the moment, like it's all over Instagram and everywhere you go, everyone always has their Invisalign trays that they're popping out. So it is one of those things. It's ever present.
Because they're imperfect, because people might comment on your teeth, or maybe people actually do comment on your teeth. That definitely happened to me and contributed to my desire to fix mine.
Sometimes I would get comments like, is that a tongue ring? Like, what's in your mouth? It's been called a tic-tac tooth. I'm mainly talking about this tooth here.
Filming and then watching yourself, editing your...
On the flip side though, like recently I've seen a couple of before and afters on Instagram, and members of the public are commenting on these posts saying, the teeth looked better before they had the work done. And that makes me so sad because it's like, you had beautiful teeth. You did not need to do that to your teeth. Like, that makes me so sad. It's the biological cost. It's the investment of time. It's the investment of money to get a very average result.
And by the way, we tend to talk about fixing your teeth as this like simple, straightforward thing, but doing any of these procedures, changing your teeth, is not cheap, quick, or easy. And by the way,
correct. And if anyone tries to convince you otherwise, they're cutting corners. There are simple cases, but every case is very different. And I would say like 90% of our cases of veneers will have Invisalign to some degree beforehand to get things in the perfect position, so you don't end up with those little shark teeth nub things going around.
And by the way, gotta mention that we must question the notion of feeling like we have to fix our teeth at all. Imperfect teeth can be perfectly healthy, and good-looking teeth can be very unhealthy, so that's not a way to measure the actual health of your teeth. But
that is true too.
Anyway, whether you like your unique or different or imperfect teeth, however you want to phrase that, I want to keep it and resist that beauty standard. Love that for you. But also, if you do want to change some things about your teeth, I feel you, because I did the same.
There are aspects to things that are non-aesthetic that can also have a big impact in terms of long-term health and longevity of the teeth. So for example, with lower teeth, if they're crowded, it can be very, very hard to clean around them. And it's fine when you're younger, but when you start getting into your 60s, 70s, 80s, that puts you at a much higher risk of something like gum disease.
It might sound hypocritical to say, oh, we should question the notion of fixing our teeth, but then say, yeah, but if you want to fix your teeth, it's a whole thing. The question of resisting versus adhering to beauty standards versus the impact that it has on your confidence, that's a whole other video. There are lots of videos about cosmetic procedures and other things that we do to make ourselves feel better. Do we do it for ourselves? Do we do it to fit in? There's a lot. Either way, we all deserve dental care. All right.
The rise of veneers.
It's true. We all do deserve it.
Now, it's very common for a lot of the top influencers to have them, and it's trickling down, and now ordinary people want veneers. Veneers seem to be the perfect, relatively quick solution. No matter what many of us do, even with braces and all the whitening in the world, our natural teeth will never look like this. So just get veneers.
Some people's do, believe it or not, and a bit of whitening, maybe a little bit of edging with some bonding to correct it. But if you don't, that's okay as well. There are options.
Just get veneers. There was actually a veneer check trend on TikTok.
Warning, if you don't like the sight of little peg teeth, please look away for a few seconds. Veneers.
I'm not gonna look.
Check.
Oh, it's so fucked up. You're going to have to replace them in the next, I would say 10 years for them, because I don't have a huge amount of hope for the bonding protocols that would have gone on for the cement underneath those crowns. They're going to get to the point where every single one of those teeth will need to be root canaled, and then they will end up losing them, and then they're going to need to do implants. And you've just created... I feel like I'm huffing and puffing a lot in this. It would be very easy from that point for them now to have to spend at least $200,000 to $250,000 to maintain what they've done for the rest of their life. That is just a crazy check to sign at that age. Biologically speaking, psychologically speaking, financially speaking, like, oh my gosh, it's a lot.
In the past, veneers used to be considered the last resort. If your teeth were really unsalvageable, there was no way that you could make them look good. Okay, veneers. But now a lot of young people who have very healthy, relatively nice teeth to begin with are just jumping straight in and often having their teeth shaved down for veneers. And by the way, not all veneer techniques are that invasive.
These are not veneer preparations, these are crown preparations, and there's a big difference. So this is a typical veneer preparation, and as long as your teeth are aligned, veneers require minimal to no preparation whatsoever.
And that's why we do Invisalign before.
I think it's really important to understand the difference between veneers and crowns. Once your teeth are down to stumps, there is no going back.
Anyway, the cost of veneers is very high and the maintenance is lifelong. This is no small commitment.
She's totally right. Like I say to people, it is like getting a Bentley or a Rolls Royce. You need to service your car on a very regular basis. Appa is a fantastic cosmetic dentist in LA and Dubai, and he's bloody all over the place. It's not a cheap exercise. And when I see veneers for $1,000, I just think that is bargain budget basement prices. So I'm like, where the hell are you getting these veneers from? Where are you getting them made? Jesus.
Veneers start at $1,000 a tooth, and for top tier aesthetic dentists, they can easily hit $3,000 or $4,000 a piece.
And that's because you pay for the craftsmanship, the materials, like there's so much that goes into it. The design as well.
Veneers typically have to be replaced anywhere from every 10 to 20 years. You
Correct.
have no option but to continue getting your veneers redone for the rest of your life. And again, some people are doing this at age 18, 20. Because the cost is so high, dental tourism has become very popular. So lots of people go abroad to do plastic surgery or other procedures. And it makes sense that people would do this for dental work as well. But here in the US, especially around the Southwest, it is very common for people to go to Mexico to get their dental work done because it's so much more affordable than it is here.
I have seen some very cooked work from overseas. Like one time there was someone who came in and it looked like they had gone down to the local hardware store and bought a packet of screws and like shoved them in.
Young adults across the UK are being lured by cheap prices in countries like Hungary, Poland, Turkey, Bulgaria, and sometimes as far as India or Thailand. Of course, there are lots of dentists and doctors in these countries that do incredible, high-quality work, obviously. But also there can be a lot of risks to traveling abroad for procedures, especially if you're getting a suspiciously cheap deal.
The thing to note as well is when you go overseas to have treatment done, when you come back, especially with stuff like implants, nobody wants to touch you because if you haven't done the work, you are not being really able to guarantee how the outcome will be. So a lot of dentists are very hesitant.
That's a red flag. Selling the perfect smile. As I mentioned, with the shift more toward cosmetic dentistry, a lot of dentists are focusing a lot more on selling procedures like orthodontics, whitening, veneers, rather than just the basic, boring exams, cleanings, fillings. And cosmetic dentistry is definitely the most profitable, so you can see why they're getting in on the action. We've seen a huge rise in doctors and plastic surgeons on social media using Instagram and YouTube as a way to sell themselves as a professional, sell their practice, and sell their work, the before and afters of what they do. And
I really like Whitney. She's really cool. Some of the stuff I see on Instagram, I'm just like, stop dancing and doing TikToks and weird shit. Like, just do some good dentistry, please.
And dentists are getting in on this as well. Dentists and other doctors often work with influencers, providing free or heavily discounted services, including filler, Botox, and even veneers.
100%.
So again, we have the classic situation of the rich people who can actually afford the thing, getting the thing for free, and then selling the thing to their audience who probably can't afford the thing. Love that. While most people can afford a new lipstick or an occasional new pair of shoes, selling $10,000 worth of new teeth is something else. Taking a medical procedure and recasting it as a marketable consumer good isn't a simple process.
Yeah, there's a lot of rules and regulations in Australia around that, but sometimes I feel like people kind of flout them a bit.
Definitely been normalized. They're presented as this very casual thing, and it's equal parts fascinating and slightly horrifying.
It's a very big status thing. So it's kind of like the latest it handbag, the Dior like saddlebag. Often you get these people who are coming in and they want to spend 30 grand on their teeth and they want people to know that they've spent 30 grand on their teeth. They'll say, I want veneers that look like I got veneers. And it's almost this like dysmorphic aspect. Like that's not going to age well with your face long term as well.